Hello, ladies and gentlemen. We are excited to welcome you to the first episode of the BioLearn podcast, a general dental topic podcast. Today's heading is COVID-19 and the reality for dentistry going forward. My name is Khair Patel. I am the Business Development Manager at Bio3D Sdn Bhd. My co-host is Mr. Ross Lee.
Hi everybody, thanks Khair for the introduction. Just a quick one, I'm also the Chief Technical Officer for Orthotech and Bio3D in Malaysia. We're a company that focuses greatly on advancements of technologies in our dental industry, and we hope to be the leaders and the providers for this.
Our guest speaker today is Dr. Barry Ren. He is the co-founder and director at iCare Dental, which currently has over 20 locations and growing in Malaysia. Welcome, Dr. Barry. Thank you for joining us today. We are delighted to have you as our first guest.
Hello, everyone. I'm Dr. Barry. I am a dentist practicing in Kuala Lumpur. Currently, I am the founder and also clinical director of iCare Dental. We have 23 clinics across Klang Valley, and we have started only 7 years ago.
Wow, that's quite a lot of progress, Dr. Barry. It's quite impressive in 7 years. Yeah, congratulations on your success. Okay, so today we're going to talk a little bit about COVID-19 and sort of how it's going to affect us going forward, both for a clinical perspective as well as perhaps on the supplier side, how we're going to manage with this thing. And so to get started with, let me ask you something, Dr. Barry. So dental clinics right now have been on hiatus or limited operability with only emergency procedures being allowed by the MOH for the last about month, 2 months. So what does a possible restart look like amidst this ongoing certainty we're facing?
So when you say uncertainty, I'm sure everyone will be uncertain of what really happened. All right. What is the possible? However, we need to actually look into what can happen in the future. Of course, one possibility is that it will be business as usual, which is going back to norm. However, this is not a normal change in the industry. This is a big change, and it's going to create a new norm, this new term that has happened. So it will be different when it starts. So the possibility is that we will have new procedures that need to be done to safeguard our staff so that we can protect our staff, our doctors, and their families, as well as our patients as well. So there will be definitely an impact on everything that we do in dentistry.
Yeah, so it sounds like it's going to impact just about every function of dentistry, patient intake,
yes, it will definitely.
The procedures that you're allowed to do or should be doing to keep safety a priority.
Yep.
Okay, all right. So our second question is, Ross will take over for this.
Okay, so yeah, that's an interesting input from the last question over there. Just another question that we also have for you that would be great for you to talk about is right now the situation has put great stress on the population at large. On the news, we can hear citizens refusing to go to the hospital due to fears of catching the virus. And understandably, this will affect dental clinics as well. So dental checkups and addressing dental ailments, which is, essential for our health, for example. In this next few weeks or the future, how do you foresee the patients' flow compared to before COVID-19? Do you think that there will be a fast recovery, or will there be a slow recovery in terms of this?
I believe dental needs is a necessity. So if you have a dental pain, you will definitely go to the dentist no matter what, because no one will be able to bear the pain. However, if you're talking about patient flow, there will definitely be a bunch of people that will be afraid of going to the dentist because they know that high risk is there. However, this will recover, depends on where you are. Some places will recover faster, some places will recover slower. It also depends on whether the dental clinic is doing any initiative where they educate their patient that they are doing all that they can to protect the staff as well as the patient. So if you are saying that if the clinic takes it as business as usual, probably they will have a slower recovery. But if a clinic takes initiative to do protective measures, to do health check, to do extra precaution to prevent the spread of COVID-19, and they educate the patient, then possibility of recovery is much faster.
Okay, so speaking about like the sort of the initiative and taking the position of the initiative to actually kickstart your business, I mean, anything new? Because we hear this term being thrown around quite a lot, the new normal. So anything new, in my experience for the dental market, usually entails costs. What do you foresee as being sort of the new costs and factors with this new normal? Because I mean, as a clinical business owner and a clinical director, I'm sure you've had to address that for your 23 clinics. So what do you think, sort of the new sort of initiative and new maybe products, because we hear a lot of that going on as well, different gadgets, you know, your vacuum units and so forth coming onto the market. What do you reckon is sort of the steps clinicians should be looking to take right now?
Okay, so first of all, we need to understand what is COVID-19, how the virus reacts. So we know that the virus basically travels through air, but it travels through the droplets. So by understanding that, we also need to know how to overcome this and prevent the spread of this disease. So in iCare Dental, as well as I believe that there are steps that we take to overcome this problem. First, when a patient first comes in, definitely we have to do a temperature check. All right. We also need to ask them to have a health screen questionnaires where we ask them whether are they sick, are they exposed to previously known COVID-19 patients, had they traveled to red zones, and all these questions, so that we evaluate that. That one is definite. All right. And when they come in, there will be extra steps to make sure that every surface they touch is clean, disinfected. Of course, they have to be able to practice social distancing as well. There shouldn't be a lot of patients waiting in your waiting area. So you at least need to get the seats. And if it's best that you can just allow 1 or 2 patients in the clinic hall at any time. After that, then it's the clinical procedures where you need to keep it cleaner. First, you need to make sure that the whole place is disinfected. So there are a lot of chemicals there that are made especially for this. For example, one that is the most rampant now is fogging. We actually see in China, in Korea, that a lot of their hospitals started to use fogging, this method. It's a cold fogging where they use certain chemicals. So there are a lot of methods that we use to disinfect the air as well as whole practice. First of all is fogging. Fogging actually gives a chemical, be it hydrogen peroxide or other things like hydrogen peroxide or hypochlorous acid, even some using sodium hypochlorite solution. There are a lot of these materials and chemicals that has been used to disinfect. And fogging is one of the best methods to actually expose the air as well as all the surface to clean it up and disinfect it. Of course, the circulation is very important, where you need to have something to suck out the air so that the air doesn't non-stop circulate in one room, which will cause cross-contamination between patients. So there are certain air purifier that has good enough HEPA filters. Yeah. And also there are exhausts that you actually push out the air from your practice. So of course, not all clinics have windows and whatnot, but at least these are the minimum measures. Of course, one more thing that on clinical side, we must make sure that our patients make sure they rinse antibacterial and antiviral mouth rinse. Yeah, there are a lot of brands that has this, and it's essential and it's proven that it reduces the bacterial and viral load in the mouth up to 90%, which is something. Of course, the dentistry, as I said, it will change. We need to do less aerosol treatments.
Okay, so less aerolization, essentially. So things like scaling and things of that nature will certainly be affected. But what do you reckon in terms of maybe like prosthetic stages and maybe even implantology? I mean, it looks quite controlled, restricted right now, even for things of the implants, for example.
Yes, so we do everything now by demand. So if it's really necessary, then we will have to do it. However, all the measures has to be taken. One more thing that a lot of clinics has been taken has come up with is called extra oral suction. Basically, it's an extra suction unit where I purchase and we put it in front of patients, it has some have 500, even 1,500 watt of power where it sucks all the aerosol. So if there is certain aerosol, first of all, in the mouth, we already reduce the load. Secondly, when we reduce aerosol on our patients by reducing the pressure, by reducing the aerosol, by reducing the water volume and all this. And then you have extra oral suction where it captures the extra aerosol that if it releases. There are also other ways, like for example, a very, very important part of dentistry that some dentists might neglect is rubber dam. Rubber dam is a very, very important part, especially if you want to do fillings and all this. Basically, it's a rubber sheet that we separate the tooth out from the oral cavity. Not that we extract the tooth out, but it's just basically we put a rubber that's wrapped around the particular tooth or the particular arch, the whole teeth on that side, where we isolate it so that there's no saliva that comes out from our procedure.
Yeah, fully partitioned.
Yes,
basically, you're partitioning away the area you're working on.
Yes.
So in terms of that, it's also really good as patients, if they are also aware about all of these steps that you doctors can take, that from what you are explaining, there's actually a lot of steps that you can do to decrease that possibility of the aerosol, saliva is traveling in the air, the little liquid particles. So with all of this in place, actually, it generally also can make dental visit just as safe.
Of course, nothing is 100% safe. So we always try to minimize the risk, minimize exposure, minimize the load, viral or bacterial load, and all has been done is so that there is minimal risk. It's just like this is a change that will affect dentistry as is seen in HIV epidemic last time.
Mm-hmm.
Last time dentistry was practiced without gloves, without masks. It was just done just like that. And because of HIV happened in the 1990s, and it became a new norm then that dentists are mandatory to wear masks, to wear gloves. And now there will be extra steps in dentistry where probably all of us need to wear disposable gowns with face shields, with all the steps that I've said just now to make sure you sanitize everything, extra disinfection programs, extra oral suction, rubber dams, all these are so that we safeguard our patients as well as our staff.
Okay. So it sounds like there's quite a few steps that actually in a clinical situation that you can actually take to reduce the risk for both the dentist, dental hygienists, your nurses, the patient themselves as well. But so I've been thinking about this in general, and I've also been thinking about impression taking. So by right, currently we take an impression, and generally clinics are sending that impression to their labs, and at their labs it gets poured into stone and so forth, right? Is there any thought that we have today in terms of actually, so if we're actually taking an impression and we're sending it to the lab, we are actually creating another vector of possible contamination, right? You have the courier services, they may face possibility of contamination. You also have then the lab technicians when they're receiving, facing that possibility. As an aside, for example, at Orthotech, they've taken some steps where when you receive a case, it gets put aside for a few days so that it's considered sort of clean before they proceed with that their indication or their workflow. But I think right now, speaking towards the epidemic or the pandemic, I think it makes sense more and more to actually go fully digital now. Like if you're taking an impression straight from the patient and you're sending to the lab is not facing any sort of extra contamination. So what are your thoughts on this? Because I know digital is just quite new. Even after this many years, it's still quite new. It's only still transitioning, you would say. It's not even past the early adopter phase at the moment right now. But do you reckon that this sort of situation will actually spur further digital uptake? Because it certainly removes the possibility of spread from quite a big section of the dental chain, production chain. So what are your thoughts on this?
The only constant thing about this is change. And of course, businesses has to change, otherwise they will always lose out as well as be Nokia, which is totally eliminated. or lose out in the competition.
Yes.
And in impression taking, in this instance very specifically, yes, what you say is true, that when we take a mold, first of all, it's uncomfortable. Secondly, with all the saliva inside there, there could be a source of contamination, first from putting in the mouth, the trays, and then you take it out. Of course, we do have this infection solution where we put it there, but there's extra steps that can cause cross-contamination. When we send to the lab, if the lab technicians didn't process it properly, they can get infected, and then they can pass it to their staff, the colleagues, and they can pass it back to their families. So if we have the technology of getting a 3D scan, intraoral scan, where we can eliminate this process, it actually reduces the contamination pathway. So definitely this is the future. It's definitely going to be the way it will be. It will be the new norm. Digital scanning for intraoral scanning will be the new norm of taking impression or making molds for dental cases. Yeah. So intraoral scanner basically is a machine that we put inside your mouth with a video camera that it scans your teeth to get a 3D mold. And of course, all the teeth can be fully sterilized. And this we are ensured that it kills all bacteria and all virus that is available, even spores from that will cause reinfection of bacteria. So this is really safe and much more comfortable for the patients. So businesses have to adapt to the change of the new norm.
Yeah.
Yeah.
I think this will spur, I think, a little bit more uptake on the digital side as well, because overall the amount of added additional expense that clinics are going to go through, I'm sure there's quite a few clinics out there that are also looking for, ways of maybe investing upfront, but then reducing costs in the long term, because market is going to be kind of a transitionary period right now, for sure.
Yep, and then all these changes and adaptation, that is also positive in terms of not only just because of a pandemic that's going around, but also in terms of cleanliness, health. It's also a good step forward as well. Not also for comfortability of that patient as well, and ensuring that accurate things are also going back to that patient. So, Dr. Bear, well, you have many dentists that works alongside you as well. You have a big chain. Just would like to know in terms of your dentists or your dental nurses and hygienists and the people that work with you. We do know that your occupation has been rated, as one of the highest risk to being exposed to the coronavirus. Just like in our previous conversation, we talked about aerosol. That is one of the biggest reasons as well, as this could create an extreme amount of stress to not only your customers or your patients, but it can create a great stress internally for your dentists, your nurses, and your hygienists that works in your practice and your clinics. As we all have families at home that we want to make sure we don't end up taking back coronavirus or any kind of pandemic. So in terms of that, for Dr. Bear, what would be your advice maybe to your colleagues in terms of keeping sane and keeping the stress at bay as a leader as well? How are you going to help to manage this and ensure that your team is always on the ball?
So first of all, it's very important for all dental health doctors, dentists, or even auxiliaries to keep updated with the most updated information of COVID-19. Knowledge is power, nevertheless. However, as a business owner as well as clinicians, it is our duty to get the knowledge, educate the public, as well as to protect ourselves.
Of course, yeah.
And that's very important. As business owners, we need to protect our staff. And that is why iCare Dental, as well as all my businesses, are gearing towards that. We make sure that we have the best up-to-date, and we spend and invest on the safety of our staff, from PPEs, which is personal protecting gears, equipments, N95 masks, face shields, and of course, very important is education, how to actually put it on and take it off, how to wash your hands, when you go back home, don't just lay down on the sofa. You need to go and shower with soap, which all this extra education where we make sure that all our staff are protected, and not only protect themselves, they protect their family.
Yeah, that's good.
Yeah.
Yeah. So I guess in terms of that, it will be great, because your employees, they are just like a family as well. We always have to take care of each other, whether it's at home or it's in our workplace.
Yep. Mm-hmm.
Yeah. And so I think that's a pretty good discussion, Dr. Ben. I would like to thank you for joining us for our first podcast. Hope to have you back soon.
Yep.
So I just want to ask you one last thing, right? How do you feel? What I mean by that is, going forward, what are your thoughts? Do you feel a little bit of anxiousness? Are you calm and serene? Are you resolute and up for a challenge? Where do you stand? Like, how are you feeling right now?
This is a crisis, and it is a global crisis that involves many lives. In the beginning, of course, when it only happened in China, some of us are ignorant, and we didn't take it so seriously. And when the pandemic started, we felt anxious, scared, but that would be a reaction. So my most important message today is, in this crisis, are you reacting or are you responding? So the first part is reaction. When this thing happens, we react to it because either we are ignorant or we are scared or we're fearful, we are anxious. But at this time, after it has passed for some time, it's a time to respond. What's the difference between react and response is by analyzing the issue, understanding this issue, knowing all the factors in it, and then we respond correctly so that we keep the profession going on. We keep our patients safe. We keep our staff safe. And there are so many steps that we have done, is all so that we could continue to care for the dental health of the whole community. So if you ask me now how it is, my response is that I am taking up the challenge to move forward. We all have to do it together, be it for myself as the owner, my staff that are supporting me, the families that are supporting them. All of us are doing the best for the community, for our patients, for the whole dental scenario in dentistry.
And I would add to that, as citizens of Malaysia, as together
Yes, of course.
Yeah, together is the only way. There's no other pathway forward.
Exactly.
It looks like we have concluded our first episode of Let's Get Pivotal. We'd like to thank Dr. Barry for being our first guest on this episode of Let's Get Pivotal. And we'd also like to thank you, our listener, for your time. If you've liked what you've heard here, please do share and like on social media. In the meantime, be well and stay safe.